Influence of body weight, age, and sex on cerebrospinal fluid peak flow velocity in dogs without neurological disorders. Introduction. Cerebrospinal fluid CSF plays an essential role in protecting the brain and spinal cord, as it acts as a cushion, maintains homeostasis, and removes waste. CSF flow dynamics, especially peak flow velocity, can be affected by various factors including diseases such as hydrocephalus and Chiari malformations. Understanding these dynamics is crucial in both human and veterinary medicine. While there is substantial research on how factors like age, sex, and body weight affect CSF flow in humans, limited data exists for these variables in dogs. Therefore, this study aims to investigate the influence of these factors on CSF peak flow velocity in dogs without neurological disorders using phase contrast magnetic resonance imaging, PCMRI. PCMRI enables non-invasive measurement of pulsatile CSF flow, which fluctuates during the cardiac cycle. During systole, CSF flows caudally to the spinal subarachnoid space (SAS), and during diastole, it flows cranially towards the brain. These physiological flow patterns can be altered by congenital conditions or brain abnormalities. The objective of this study is to establish normative data for CSF peak flow velocity in dogs based on body weight, age, and sex, and to determine how these factors affect CSF flow, providing useful insights for future clinical assessments. Materials and methods. Study population animals. This prospective cross-sectional study was approved by the Cantonal Veterinary Office of Bern. Client-owned dogs undergoing anesthesia for various low-risk diagnostic or surgical procedures were recruited from the Vetsus faculty of Bern. The study included dogs that were neurologically normal, as confirmed by medical history and a thorough neurological examination. Dogs with any past or present neurological abnormalities were excluded. A total of 32 dogs were enrolled in the study, with a wide range of body weights, ages, and both sexes represented. The median age of the dogs was 2.08 years, range 0.35 to 11.48 years, and the median body weight was 23 kg, range 4 to 53 kg. Of the 32 dogs, 16 were male and 16 were female, with a range of dog breeds, including Labrador Retrievers, Border Collies, Jack Russell Terriers, and Great Danes. Anesthesia protocol. Prior to MRI, the dogs were fasted for at least 6 hours. Pre-anesthetic medication included intramuscular methadone, 0.2 mg/kg, and dexmedetomidine, 110 kg, depending on the dog's behavior. Propofol was used for induction, and anesthesia was maintained with sevoflurane and oxygen and air, 60% oxygen. Dogs were placed on mechanical ventilation during MRI to control end-tidal CO2 between 35 and 40 mmHg, ensuring that ventilation parameters remain stable throughout the procedure. Comprehensive monitoring, including pulse oximetry, non-invasive blood pressure, capnography, and spirometry, was used to ensure the safety of the patients. Magnetic resonance imaging MRI protocol. A 1.0 Tesla MR unit was used to perform imaging in the dogs. Each dog was positioned in sternal recumbence, with the head placed in a knee or head coil depending on head size, and positioned with the neck extended to maintain a consistent angle. Special care was taken to avoid compression of the jugular veins. A sagittal T1 weighted sequence was performed first to rule out any structural brain abnormalities and to plan the subsequent phase contrast sequences. CSF flow measurements were taken at 3 anatomical locations. 1. Mesencephalic aqueduct, the narrowest part of the midbrain. 2. Foramen magnum FM just caudal to the occipital condyles. 3. Second cervical vertebral body C2 midline. The parameters for PCMRI were standardized across dogs, with a slice thickness of 5 mm and voxel size of 0.6 mm x 0.81 mm x 5.00 mm. Each location required careful manual placement of regions of interest ROI in the ventral and dorsal subarachnoid spaces SAS, excluding areas occupied by large blood vessels. The resulting time velocity curves provided the CSF peak flow velocities in CMS. The velocity encoding bank was adjusted based on flow rates to prevent aliasing artifacts, and multiple measurements were taken to ensure accuracy. Statistical analysis. Data analysis was performed using non-parametric statistical methods due to the small sample size. Associations between CSF peak flow velocity and variables such as body weight, age, and sex were analyzed using linear regression models and Pearson correlation coefficients. Mann-Whitney U tests were used to evaluate differences between groups. Results. CSF flow velocity measurement. CSF peak flow velocity was successfully measured at mesencephalic aqueduct in 27 of the 32 dogs, 84.4% success rate. Foramen magnum in 29 dogs, 90.6% success rate in ventral SAS, 62.5% in dorsal SAS. Second cervical vertebra C2 in 20 dogs, 62.5% success in dorsal SAS, 59.4% in ventral SAS. In 12 dogs, flow velocity measurements were successful at all 3 locations, showing a mean age of 3.28 years and body weight of 22.1 kg. Body weight and CSF flow velocity. A significant positive correlation was found between body weight and CSF peak flow velocity at the mesencephalic aqueduct, P equals 0.04, ventral SAS at C2, P equals 0.02, and dorsal SAS at C2, P equals 0.03. Larger dogs, 20 kg, exhibited higher CSF peak velocities compared to smaller dogs, 10 kg. For example, dogs weighing over 20 kg had higher mean CSF velocities in both ventral and dorsal SAS at C2, with average velocities exceeding 2.69 cm s in the ventral space. Age and CSF flow velocity. Dogs aged 2 years had significantly higher CSF peak flow velocities at the ventral SAS of the FM, p equals 0.05, compared to older dogs, 2 years. However, no statistically significant correlation was found between numerical age and CSF peak velocity at any other location, suggesting that age has less impact on CSF dynamics beyond the first 2 years of life. Sex and CSF flow velocity. Male dogs exhibited significantly higher CSF peak flow velocities in the ventral SAS of the FM compared to female dogs, p equals 0.04. At other locations, while males generally had higher peak velocities, the differences were not statistically significant. Discussion. This study demonstrates that body weight, age, and sex significantly affect CSF peak flow velocity in neurologically normal dogs, with larger, younger, and male dogs showing higher flow velocities. These findings suggest that these factors should be taken into account when interpreting CSF flow measurements in clinical settings, particularly when assessing dogs for conditions like hydrocephalus, Chiari-like malformations, or other disorders that affect CSF dynamics. Body weight influence. The significant correlation between body weight and CSF flow velocity is notable, particularly given the large range of body sizes in dogs compared to humans. Larger dogs exhibited higher flow velocities, which may reflect anatomical differences in skull and spinal cord size, the force of cardiac pulsation, or differences in intracranial compliance. The authors suggest that body weight should be considered a critical factor when assessing CSF flow in diagnostic evaluations, especially in large breeds. Age influence. While the study found no correlation between numerical age and CSF flow beyond 2 years of age, dogs 2 years had higher flow velocities, especially at the FM. This is consistent with findings in human pediatric populations, where younger children have higher CSF velocities due to greater arterial pulsations and brain compliance. However, the lack of a clear age-dependent trend beyond 2 years suggests that CSF flow stabilizes as dogs mature. Sex influence. The higher CSF flow velocities observed in male dogs aligned with similar findings in human studies, where males tend to have higher CSF velocities in certain brain regions. The authors hypothesize that this may be due to hormonal differences or neural structural variations between sexes. However, more research is needed to elucidate the precise mechanisms underlying these differences. Conclusion. This study is the first to systematically assess how body weight, age, and sex influence CSF peak flow velocity in dogs. The findings highlight the importance of considering these variables in both research and clinical practice when interpreting CSF flow dynamics. The study provides a framework for establishing normative CSF flow velocity values in dogs, paving the way for more accurate diagnostics in cases involving altered CSF flow. Future research should focus on expanding these findings to include more diverse populations of dogs, particularly those at risk for neurological disorders affecting CSF dynamics.